Most medical boards are constituted of physicians who are political appointees, and that is an inherent conflict of interest.
The people who are policing the doctors have an interest in protecting the doctors.
Absolutely.
Dr. John Hall spent 25 years practicing pediatric anesthesia and critical care. Later in his career, he went to work as the executive director of the Mississippi Medical Board. But after Dr. Hall pushed the Mississippi Medical Board to be more aggressive in disciplining doctors, he found himself out of a job.
I believed in the mission of the medical board, and I thought this is a place where I can do this and do some good.
You were pushing too hard.
Absolutely.
Admittedly, I come to the medical board with a bit of a different background, and I come with the overriding commitment of justice delayed is justice denied. And I become concerned when we are going through our discipline cases and we are disciplining physicians for what we determine to be misconduct that occurred in 2012 or 2014. And we don't know what happened between 2012 and today or 2014 and today. Have they, have things gotten worse? Have things gotten better? I'm not overly impressed yet, okay? Hopefully that'll come.
Do members of the general public understand everything they could understand about the doctors who are treating them?
Oh, absolutely not.
Robert Oschel spent 15 years at the Department of Health and Human Services in Washington, where he worked with the National Practitioner Data Bank, a federal database used by hospitals to keep track of bad outcomes by doctors. Oschel says there's a problem. The National Data Bank doesn't share doctors' names with the public.
If doctors' names were listed in the data bank, would it save lives?
Sure, because there are physicians who have very bad records who are still practicing.
Oschel scoured the data bank and turned up an alarming fact. Less than 2% of doctors are responsible for more than half of all malpractice settlements.
It's a very small proportion of physicians that have caused the bulk of the problem. And even worse, only 1 in 7 have had any action taken against them by any state.
Meaning most of the bad doctors are still practicing.
Right.
Folks have to realize is that the medical board is not a substantial barrier to them being injured by a physician.